good day. I am student nurse Esther Baguio and I am going to perform an oxygen administration. So now, first, in preparation, I am going to determine the need for oxygen therapy and to verify the doctor's order for the therapy. So we have here for patient Genesis Lewis with a doctor's order for start with nasal cannula at 2 ml per minute and a vital signs with the respiration rate of 23 cycles per minute, and for the blood pressure which is 110/90. It is to ensure that the rise of medication administration is strictly observed before initiating oxygen and to make sure that there is a physician's order. Then, I am going to perform a respiratory assessment to develop baseline data if not already available. The rationale for this is to develop a baseline data if not already available and a guide for evaluation of care. And a thorough respiratory assessment consists of inspection, palpation, percussion, and auscultation. Then, in preparing the clients and support people, first I am going to assist my client to examine follower's position if possible, and the rationale for this is the position promotes a patient chest expansion with the least amount of effort. So sir, I will just move you in a semi-follows position so you have a comfortable position during the oxygen therapy. Then, I am going to explain that the oxygen is not dangerous when safety precautions are observed. It is that the patient would be comfortable throughout the administrations and the patient and significant others will be educated to the do's and don'ts while on oxygen therapy. I am going to inform my clients and support people about the safety precautions connected with oxygen use. And since the tank is combustible, keeping the oxygen from any open flame or heat source or from anything that could cause a spark, smoking or not smoking or letting anyone else smoke near the oxygen equipment. This is also for the safety precautions for our establishment. Then, now, prior to perform the procedure, I am going to introduce myself and verify my client's identity using the agency protocol. Good day, sir. I am student nurse Esther Baguio and I am going to administer an oxygen therapy. But before that, I am going to verify your identity, which is, I would like to ask, what is your name and when is your birthday? Kailan po kayo pinanganak, sir?
2012.
Date po?
February 28.
Okay, thank you, sir. So, verifying using the agency protocol by looking at the wristband. So, he is Mr. Genesis Vince Nuez, and he was born on February 28, 2000. Now, the rationale for this is to establish rapport to my patient and also to ensure that the right client serves the right medication for him. Then, I am going to explain to my client what I am going to do and why is it necessary, how he would be able to participate during the procedure. It is for him to know what he can do and what to have a good flow during the assessment. Sir, I am going to give you an oxygen therapy. So I would like to first to give you some small details about our oxygen therapy. Oxygen therapy is provide you an oxygen for you to have right amount for your oxygen and provide you a proper normal within your normal limits of respiration, and it will ease you from difficulty breathing from a normal breathing po. So also by discussing how the effects of oxygen therapy will be used in planning for 40K or further care or treatments. The rationale for this is that oxygen therapy po is generally safe and there are some side effects on it. Also, sir, I would like to give you an information that oxygen therapy has a tank inside that will surely it is a combustible material, which is also I would like to remind you and for your mother that oxygen therapy that our oxygen tank is combustible. So I would like to warn you that we don't tolerate or we likely to please that no smoke. This establishment is a no smoking area, and please do not create or make some fire here like manigarilyo, mag sindi og kalayo, ana sir ha, para dili ta mangbuto sir ha. Okay lang sir, ma'am. Yes. Okay, thank you. So oxygen poses a fire risk. So you should never use or flammable materials when using oxygen. If you use oxygen tanks, make sure that your tank is secured and stays upright. Then I am going to perform hand hygiene and observe other appropriate infection prevention procedures. It is to deter spread of microorganisms. So, then I am going to provide my client a privacy appropriately for them to protect their client's integrity. Sir, if it's okay for you, sir, i-close na po ang curtain, sir, para nakay privacy, sir. Okay lang po ba? Okay, thank you, sir. Then, it is for your safety, privacy, and also for your integrity, sir. Okay po. So, I'm going to close the curtains. Then, next is to setting up the oxygen equipment and the humidifier. First, I am going to attach the flow meter to the wall outlet or tank, and the flow meter should be in the off position. So, this is our flow meter. I am going to turn it off first so that in order to begin oxygen therapy, prior to starting therapy, this is also to confirm that the equipment is safety and to clarify the functionality of our equipments. Then, if needed, fills the humidifier bottle before coming to bedside and attach the humidifier bottle to the base of the flow meter. So here is the humidifier with the water inside. I'm going to attach it to the flow meter base. And then, the rationale for this is to assure that the oxygen delivered is well modified to prevent mucosal dryness. Then, ensuring that the oxygen provided is well humidified to prevent drying of the mucosa. It is to ensure the appropriate kind tubing for the right dose of oxygen concentration following doctor's order, which is start with nasal cannula. So we have here the nasal cannula for our patient provided. And we also have here, I'm going to turn on the oxygen at the prescribed rate and ensures proper functioning, which is 2 ml per minute. So I'm going to adjust it with the 2 milliliter ml per minute. Then I am going to check that the oxygen is flowing freely through the tubing. This is done to confirm that the equipment is safe and working before starting the therapy. The tubing should be free and of bends, and the connection should be secure. Also, as the oxygen passes through the humidifier, bubbles should appear, and the oxygen should be felt at the cannula's outlet. Oops. Then, sets the oxygen at the flow rate ordered. As per doctor's orders, use the proper tubing for the proper oxygen concentration with the 10 rights to provide medication. So we have the doctor's order which start with nasal cannula at 2 ml per minute. And for the application of the appropriate oxygen delivery device, I am going to put the cannula over the client's face with the outlet prongs fitting into the nares. So we have here the outlet prongs fitting into the nares and the tubing through a hook around the ears. So if the cannula will not stay in place, place it at the side of the face. Sir, I am going to put this nasal cannula on your nose, sir, ha? Sobrang sir. So the rationale for putting some tape at the side of the face of our patient, it is to securely secure the oxygen cannula and ensure that it doesn't fall out from the nostrils, causing the oxygen therapy to be inadvertently stopped. Then, pads the tubing and band over the ears and cheekbones as needed. This will prevent skin ulcerations under the tubing while oxygen therapy is ongoing. So I am going to put some pads at the side of the ears, at the back of the ears. And that's the other the vice versa. So, next, I am going to assess for my client's vital signs. I am going to check for the level of anxiety, the color, the ease of respirations, and provide support while the client adjusts to the devices. So, I am going to check if there are some ulcerations or any redness, spot, or irritations on her at the back of the ears, on his nasal part, and color of ease of respirations of our patient. So he has already have a normal breathing after we put the nasal oxygen therapy on on his. So, the level of anxiety of our patient, sir, are you comfortable right now? Not like before, a while ago? Okay, thank you. So, this is to ensure that the therapy is well tolerated by the patient with no signs of hypoxemia or hypoxia. Then, I am going to assess my clients in 15 to 30 minutes, depending on the client's situation. And also, I am going to assess the clients regularly for clinical signs of hypoxia, tachycardia, confusion, dyspnea, and restlessness, and also the cyanosis. I am going to review the oxygen. I am going also to review the oxygen saturation or the arterial blood gas results if available. So he have an oxygen saturation of 62 a while ago. Then now I am going to check for the oxygen saturation of our patient. Thank you, sir. So we have the oxygen saturation for our patient with 86 cycle per minute. And the rationale for this is to evaluate the care provided based on the baseline data gathered. Then, assessment for nasal cannula, I am going to assess the client's neck for incrustations and irritation. Then, so there's no irritation, sir, no redness found. Then I am going to apply a water-soluble lubricant as required to soothe the mucous membranes and to assess the top of the client's ears for any signs of irritation from the cannula tubing. If present, padding with gauze pad may help relieve the discomfort. So I put some water-soluble lubricant. Then I'm going to put some gauze pad may help relieve the discomfort of our patient from ears and for my client's ears. Then the rationale for this is to ensure the comfort of the patient all throughout the oxygen therapy. Next is I am going to inspect the equipment on a regular basis by checking the liter flow and the level of water in the humidifier in 30 minutes and whenever providing care to the client. I am going to make sure the safety precautions are being followed. Then I am going to make sure the safety precautions are being followed. So, the patient or the patient is following the no smoking premises and also the significant others. There's no creation of flammable materials in here inside. Then the tank is stay upright. Then I am going also to check for the liter flow and the level of water in the humidifier. So we have here still on the baseline part. Then the rationale for this is to ensure the safety of the patient and significant others. Then lastly, I am going to perform a hand washing and hand hygiene and also an aftercare after this procedure. This procedure, this is to prevent the spread of infection, and also lastly is to document the findings of my client by record using forms or checklists supplemented by narrative notes when appropriate. The rationale for this is to part of the 10 rights of drug administration. The record gives a correct account of the therapy and care provided for our patient. So, I have here with the respiratory IR of our patient with 18 CPM and with the vital signs of SO2, oxygen saturation with 86 CPM. Beats per minute. And there are no signs of cyanosis, hypoxia, different body, difficulty of breathing, and no irritations found on the skin of our patient. And that would be all of my procedure. Thank you.